Good morning and welcome everybody back to our COVID Live webinar. Thank you for joining us today. And as we'll introduce our health systems flu vaccination campaign, as well as provide an update on our system's response to COVID-19. I'm Dr. Laura Iavicoli, Senior Assistant Vice President for Emergency Management, and I'm joined today by Dr. Syra Madad, Senior Director of the System-Wide Special Pathogen Program. So let's begin today by looking at the total number of COVID-19 cases and hospitalizations in the city and our health system, and please follow along with the PowerPoint slides that will now appear on your screen. So the numbers are all very reassuring. This is the New York City data from the New York City Department of Health COVID-19 data page that is available to anybody to view. The percent positive cases, confirmed cases, probable cases, hospitalizations, confirmed deaths are all decreasing, which is all great to see. Next slide. And as you can see, the percent of New York City residents who tested positive for the 7-day average is decreasing. The last time that we had the numbers that are completely filled in, which is anything except that gray rectangle, was 2.01%. For new cases of COVID-19, the 7-day average on the right, new probable cases are at 354, new confirmed cases are a little over 1,000, and new confirmed and probable are about 1,400. And as you can see, they're all downcreasing. Next slide. COVID-19, a number of people admitted to New York City hospitals for COVID-like illness, and a percent of those who then tested positive. As you can see, the percent who tested positive, which is a really good marker that things are trending in the right direction, is continuing to downtrend. We're at 15% lately of admitted patients who are testing positive for COVID-19. And for new New York City COVID-19 hospitalizations per 100,000, as per reported by the New York State, again, we're seeing a decrease in the 7-day average. Next slide. This is the New York City data again. On the top left are cases, and the area in gray is still filling in with data, but the total number of cases, as you can see, we're on a downtrend, 1,679. At the bottom, the total number of hospitalizations also trending down. The latest data that is completely filled in is 80. And the 7-day average confirmed and probable deaths for COVID-19 is at 13 and seems to have come down from about September 12th. Next slide. If you also look at this per borough for hospitalizations for COVID-19, on the left side, you can see the Bronx and Brooklyn, the numbers coming down. And then on the right side, Manhattan, Queens, and Staten Island, you can see downtrends in all of the New York City COVID-19 hospitalizations in those boroughs. Next slide. So if we're looking at variants, this table shows variants that have been observed in New York City and their classification. Currently, the B.1.617.2, the Delta, is the most widespread variant in the city. And we're continuing to monitor and carefully look at other variants and any new ones as they develop. But Delta has really taken over in the city, in the state, in the country, and really in the world. And as a result, a new classification of the variants has been implemented, which is variants being monitored. And all of the other variants that we're looking at are variants that are being monitored. And these are variants that have evidence that they are more likely to spread, cause reinfection, cause severe illness, but they are no longer circulating enough to pose a significant risk in the US. So as you can see, there's a number of them that we're keeping a close eye on, but we are seeing predominantly Delta. Next slide. For the New York City data in terms of transmission levels, this is really exciting because this is, since last week, the first time we have seen anything other than completely red on this graph in at least a month. So this is how easily the virus is being spread throughout the city. And you can see that citywide in the Bronx, Manhattan, and Queens, there has been a little bit of a decrease in the amount of transmission. We've gone to substantial transmission instead of high. So we're still seeing high transmission in Brooklyn and Staten Island, but it's a good sign that all of the numbers are coming down. Next slide. So if we transition to the New York City Health and Hospitals data, we're seeing similar downtrends. For our community PCR testing positive, we've seen a plateau for about 10 days, with today's count at 1.61% and the 7-day rolling average at 1.23%. But as you can see, the overall trend really is a downtrend since about mid-August. Next slide. Influenza-like illness and COVID-like illness in the emergency department. Interestingly, we've seen an uptrend on this one for about 4 weeks. Today's count is at 114, but again, this takes into account many other viruses that are circulating at this time. So that can account for the fact that this particular graph, we're seeing an uptrend. Next slide. For our COVID-19 admissions, we're again seeing a downtrend for about the past 4 weeks. This is really a promising trend that we're looking at, and today's count is at 98. Next slide. And for the number of ICU COVID-19 admissions to our throughout our system in our ICUs, we've also seen a 4-week decline, with today's count at 24. And our ICU intubated has been declining. We were up in the 20s. Today's count is at 10. Next slide. And I just like this graph because it just tells a very good story. The orange line are the 3 waves of COVID that we have seen so far. Wave 1 is the first spike, wave 2 is the second, and this wave 3 that we're coming down from is the third. And as you can see, the blue line, which is our non-COVID admissions, continues to trend up. And what I would say about that is just as our volumes of non-COVID increase throughout the system, any increase of COVID hospitalizations really puts a strain, whether it's a very large wave or a smaller wave, puts a big strain on the system. So this just tells a really good story, and it's a good graph to just keep an eye on. Next slide. So before we transition to talking about our flu campaign, let's just talk about our COVID-19 vaccination very briefly. So there is the ability to get first, second, third doses and boosters now. And in terms of eligibility for these, for first dose eligibility, all individuals 12 years of age or older that reside in the United States are eligible to be vaccinated at New York City Health and Hospitals. The second dose would be scheduled at the time of your first dose. For third dose, for immunocompromised, all individuals who are 12 years of age or older and moderately or severely immunocompromised or receiving immunosuppressive medications treatments are eligible for a third dose of the mRNA vaccine. So at this time, there's no recommendation for additional doses for those who received the Johnson & Johnson COVID-19 vaccine. Next slide. And now for boosters, this is very exciting for our health system. The following individuals are eligible for a booster of the Pfizer COVID-19 vaccine, and that would be individuals who are 65 years or older, individuals who are 18 to 64 who have either underlying medical conditions or a higher risk of COVID-19 exposure due to their job, for example, healthcare workers, or because of where they live or frequently visit, for example, a homeless shelter. Also, those living in a nursing home or other long-term care facilities are eligible for the booster. You will only be able to get a Pfizer booster if you received a primary series of the Pfizer vaccine and the second dose was at least 6 months ago. So other vaccines, mRNA, Johnson & Johnson, at this time are not eligible for boosters. How do I get my booster? The external scheduler has been updated to accommodate online scheduling of appointments for the new booster dose of the Pfizer 19 vaccine. And the link is right there. You can access it from the intranet or the internet. It's available at all 11 acute care facilities. You can just walk in. You don't have to make an appointment, or you can schedule online through the scheduler link above. Eligibility is a self-attestation, and you need to bring your CDC COVID-19 vaccine card so they can document appropriately on your card. And you see at the bottom when you get to the page for the scheduler, very self-explanatory. You either pick your first dose, your third dose, or scheduling your booster appointment, and it'll take you down the pathway that's appropriate for what you're looking for. I'm just going to talk about a couple of links that will be helpful to some people, and if you want to take a screenshot of this so you can access these links afterwards. The first link is the policy for staff that are allowed 4 hours of leave for any dose of COVID vaccine, whether it's first, second, third, or booster. There is 4 hours of leave that are given in order to get to your appointment, in order to get through your appointment, in order to return to work. The next really helpful link are the third dose questions about the third dose, and this is anything you'd like to really know about getting a third dose. This really is a helpful link to look at. And equally for boosters, the FAQs, there's that link there. So these are very helpful, and please take a look at them on our COVID-19 resource hub. I will turn it over now to Dr. Madad for a comprehensive look at what we are doing to prepare for another flu season.
Great. Thank you so much, Dr. Iavicoli. So I'm going to cover H&H's seasonal flu campaign for this flu season, the 2021-2022 flu season. I'm going to first start by mentioning the 5 different factors as we look at, what impacts flu season, and as we talk about the burden of flu season across the nation, and what are some of the factors that kind of go into knowing whether it's a severe flu season, a moderate, or a mild. So these 5 factors first include the characteristics of circulating influenza viruses. The second is the timing of the flu season. The third is how many people have pre-existing immunity to circulating influenza viruses, how well the flu vaccine is protecting those who are vaccinated against illness, and then finally, how many people get vaccinated. The 6th factor, given COVID-19, is the co-circulation of the virus that causes COVID-19 along with the flu viruses. So it's unknown how big of an impact it's going to have on this flu season. So the best way to protect yourself against flu is to get vaccinated, and the best way to protect yourself against COVID-19 is to get vaccinated against COVID-19. Next slide, please. So one of the questions we often get is, what's the benefit of getting the flu vaccine, whether it's this year, previous years, and years to come? And there's a lot of benefits. And in fact, we have some really great data to show that. So first, the flu vaccine keeps you from getting sick and spreading it to others. And if we just look at last year's flu season and the impact it's had in terms of the vaccination for flu, so during the 2019-2020 flu season, flu vaccination prevented an estimated 7.5 million influenza illnesses, 3.7 million influenza-associated medical visits, and over 105,000 influenza-associated hospitalizations, and prevented over 6,000 influenza-associated deaths. Those are huge numbers. So getting vaccinated against flu is really important. Next slide, please. So I'm going to cover 8 things you should know about H&H's flu campaign for this year. The first is all flu vaccines will be quadrivalent. And what that means is that the vaccine protects against 4 different flu viruses. So to get your flu vaccine for staff, there's multiple different locations. For acute care facilities, it could be at the COVID-19 vaccine hubs, primary care clinics, and OHS. For Gotham Health sites, it's at the COVID-19 vaccine hubs, primary care clinic, and other locations. If you're in a post-acute setting, you can go to OHS to get your flu vaccine. And if you're located at central office, you can get it at 50 Water Street. So you can check on the Stop Flu intranet page, and we have a vaccine schedule that shows you the timing and the locations to get your flu vaccine. We also have flu coordinators list posted on the Stop Flu website, so if you have any questions, you can certainly reach out to your local flu coordinator as well. Next slide, please. The third thing you should know about this year's flu campaign is that you will receive a flu vaccine sticker that will be affixed to your ID badge. So every year you get a flu sticker once you're vaccinated, and you can put it on your ID badge. If you get vaccinated outside of health and hospitals, all you have to do is just bring proof of documentation of that vaccination, along with completing a vaccination record form that we can provide to you. And then you go ahead and share that with your local OHS, and you can go ahead and get your flu sticker for this current flu season. The fourth thing you should know is that flu vaccines and COVID-19 vaccines, for example, if you're going to get your second dose, your third dose, or a booster, can be given at the same time. So just go ahead and check with your local flu coordinator to see at the clinic that you're going to go to if they offer both vaccines. Next slide, please. The fifth thing you should know is that COVID-19 vaccine stickers are also available for those that are fully vaccinated. This is completely optional, and you can go to OHS to go ahead and get your COVID-19 sticker. So this just shows you that you're fully vaccinated and that you're one of our COVID-19 vaccine champions, but it's completely optional to get this sticker. The sixth thing you should know is that you can visit the Stop Flu website to get the most updated FAQs, resources that we've put together like signages and other flu-related resources. So go ahead and go to the Stop Flu website to get those that information. The seventh thing you should know is that you can visit the COVID-19 Resource Hub for the clinical guidances. So right now we have 2 updated clinical guidances for this year's flu season. The first is reducing the prevalence of influenza during COVID-19 pandemic, and we have a number of different information on that particular clinical guidance. The second clinical guidance we have available is testing and treatment guidance when SARS-CoV-2, which is a virus that causes COVID-19, and influenza viruses are co-circulating. So those are the 2 clinical guidances that are currently available. Next slide, please. The last thing you should know is that because of the COVID-19 pandemic and because of also universal masking, regardless of your vaccination status, whether you're vaccinated against flu or COVID-19, we want to make sure that you're continuing to mask at all times, at all locations on H&H premises. Next slide, please. And then lastly, this is an image of our Stop Flu website. You see 2 orange arrows. The first one is showing you where our flu coordinators list is. So every single H&H facility has a flu coordinator. If you want to see who your flu coordinator is, go ahead and click on this link and you'll get the name and email address of your flu coordinator. So if you have any questions, you feel free to reach out to them. The second arrow is showing you the schedule. So if you want to know what the schedule is for this year's flu vaccine clinic, go ahead and click on that and you get to get the schedule. I'm going to go ahead and hand it over to Dr. Iavicoli.
Thank you once again for joining us today, Dr. Madad, and for your informative updates as always. And we now have a few questions for you related to the flu season. Our first question: is it possible to get the flu and COVID-19 vaccine at the same time?
You can get both the flu and the COVID-19 vaccine at the same time, regardless of the timing. So if you want to get it in the same visit, you can go ahead and do so. If you want to get it a day or 2 after, that's completely fine. So regardless of the timing, you can get both vaccines. If you want to get it at health and hospitals, just make sure that you reach out to your flu coordinator to ensure that the clinic you're going to is offering both vaccines.
Can I get the flu and COVID-19 at the same time? How far apart do I need to space the vaccines?
Yes, so you can get both vaccines at the same time. The first question that I believe you had asked was the infection. So for example, can you get both flu and COVID infection at the same time? And the answer to that is that yes, you can actually get infected with both flu and COVID at the same time. Health experts are still seeing how common that is. And so because some of the signs and symptoms may be very similar, it's important for you to get tested to see whether you're sick with flu or COVID. And so go ahead and reach out to your healthcare provider or come to an H&H COVID-19 testing clinic, for example, if you think you have COVID, to get tested. But in terms of the vaccination, can you get both the vaccines at the same time? Yes, you can.
It should have been, can I get flu and COVID infection at the same time? So thank you for correcting that and answering that. The third question is, should a flu vaccine be given to someone who is positive for COVID-19 or vice versa?
If you're currently sick, you should defer your vaccination for whether it's COVID-19 or for flu, and you should wait until you are no longer symptomatic. And so whether you have symptoms or you don't have symptoms, if you have, for example, a positive COVID-19 test, you should defer, for example, for up to 10 days if you're symptomatic, or from the date of your test that you had gotten. If you have any questions, certainly seek out your healthcare provider or ask us here at Health and Hospitals. But we do want to make sure that you are feeling healthy when you come in for your COVID-19 or for your flu shot.
Great. Okay, and the last question is, how can I upload proof of my flu vaccine if I have already received it outside of New York City Health and Hospitals?
If you get vaccinated outside of health and hospitals, all you have to do is you get a form, which is it's a participation record form of getting a a flu vaccine. You complete that, just gives you provide your name, information, your TK ID, and then you also bring your proof of documentation of getting your flu shot from another entity. So whether you're going to your local pharmacy or your own healthcare provider and you get the flu shot, just go ahead and get that documentation that you received your flu shot, and then fill out that form and then give it to your local OHS, and they'll go ahead and put that into our employee vaccine registry, and you can go ahead and get your flu sticker.
Great. This is all such really, really informative and needed information. So once again, thank you for being here, Dr. Madad, and for telling us what we need to do to make sure we control the spread of flu this fall. I mean, imperative, important information. So that includes today's webinar. And as always, if you have any questions for us, please submit them to the COVID-19 readiness email address that will now appear on your screen. Thank you for joining us, and be sure to make your appointment to get your flu shot. Stay safe, everybody.